India's overnight COVID-19 infection rate is higher than ever recorded anywhere in the world since the pandemic began. The country is reporting over 345,000 new cases and over 2,000 fatalities. The second wave surge is taking place amid an oxygen shortage and faltering health system. Crowds have formed outside hospitals in major cities, which are filled to capacity. All right, so I want to get the very latest on the ground, bring in our correspondent in India, Neha. Poonia. Neha, a very good morning to you. Give us the current situation on the ground with regards to COVID-19 numbers, case numbers, as well as fatalities. What are we learning this morning?
Well, for another day, Blaine, the third day in a row, India has posted more than 300,000 infections, and with this, it's now earned the dubious distinction of being the only country in the world of recording as many cases in a single day. But the problem is that with numbers increasing the way they are, with the infection and the surge being so massive, not everyone who has COVID-19 symptoms is even able to get themselves tested. So it's quite likely that the actual outbreak is a lot larger. We're also seeing for at least 3 days now more than 2,000 people dying every single day. Here again, there are concerns that India is undercounting its COVID-19 fatalities because while official records are showing just a few deaths for every city or region, crematoriums in most places, including here in Delhi, are forced to work round the clock. They've been forced to increase capacity because the influx of dead bodies has been very high.
I mean, when you talk about an influx of dead bodies, it really paints a bleak picture, dire situation. What is driving this surge, Neha?
Well, there's several factors. For one, at the start of this year, you saw India recording very few cases. Numbers had dropped to record lows, and as a result, almost all COVID-19 restrictions were lifted, and we saw a sense of normality return. There were large events being held, both religious and cultural. You have, just until a few weeks ago, major election rallies also being held in different parts of the country. There was a sense among many here in the country that India had defeated COVID-19, that the risk had passed, which is why everyone's guard was really low. The other problem seems to be that there has been a mutation in the virus in the country. It's been identified as the B1617 mutation, and many experts believe this is why cases are surging, but particularly here in Delhi, which is now the worst hit city in the country. It's the variant that was first identified in the UK that seems to be leading to this big surge in cases. So it's not just human behavior, it's also the way the virus is adapting in the months and the weeks as we're talking.
Oxygen manufacturing companies have ramped up their production in terms of oxygen. This is one of the big factors in India, I understand. Give us the state of play with regards to that.
Well, the shortage of oxygen supplies has been the real crisis in the last few days. Many people are now dying not only because of COVID-19, but because they cannot access basic medical care. Yeah. If you go outside any major hospital here in the national capital, you'll find people stretched out on gurneys, lying in ambulances or in their cars, and they're hooked up to their personal oxygen cylinders, hoping that they'll get admission. But most hospitals are running at full capacity. Many have started turning people away because their own supplies are running really low. In the last 2 days alone, 40 people have died at 2 different Delhi hospitals because oxygen supplies have been dangerously low. And this has been a concern that's been repeatedly flagged by several regions to the central government. And the Prime Minister has now taken stock of this situation. India plans to airlift oxygen supplies from many countries. Production is going to be ramped up. The Air Force has been pressed into service, and the railways. India's extensive rail route is also being used to transport liquid oxygen to different parts of the country.
Right. Ideally, Neha, we would like you on the street reporting, giving us a sense of what's going on there. But you are in your home. Is there a concern for journalists in India in terms of going out and reporting? Are they concerned with regards to their safety in terms of contracting the virus? Is that a major concern?
It absolutely is. Until a few days ago, we were all out on the streets doing our jobs, trying to cover the story from the very epicenter. But, the risk of contracting the disease is so very high now that most people are taking all precautions they can. For example, every single morning when I log into, my Twitter or Facebook account, it's an unending feed of people I know who are sending out SOS messages, people who cannot get medical care for their family members and friends, no matter how privileged they are. So right now in the country, it's a major risk, it's a major threat. Being alive is a privilege. Not needing medical assistance is a privilege, which is why, everyone's being told to stay put, to hunker down and wait this out, because India's healthcare facilities cannot possibly take any more strain. And the worry is that this current peak, this current wave, beg your pardon, is only going to peak around mid-May. So we're possibly, we have 3 more weeks of this situation to deal with.
We've been reporting here in South Africa that South African President Cyril Ramaphosa has thanked more than 100 countries that have supported the call by this country and India for a temporary TRIPS waiver on COVID-19 vaccines. What's the feeling on the ground with regards to this call for this waiver?
I think India's always maintained that this pandemic cannot be fought, which is why at the very beginning of the country's own vaccination drive, India was one of the few countries that actually exported millions of doses to at least 80 countries, including many on the African continent as well. The government has repeatedly said you cannot hoard, intellectual property rights when it comes to the development and distribution of vaccines. And that's something that many Indians are now talking about, especially given how big the surge during the second wave in the country has been. Because one of the other challenges has been that the government says it wants to ramp up vaccinations. So far, it's only been able to target those above 45 years of age, but it's reached only 1% of its 1.3 billion people. But the fact of the matter is, India's also running out of vaccines. It's the world's largest producer of vaccines, but it doesn't have enough, which is where, these sort of barriers need to be done away with to ensure that countries that need assistance are able to get it without an added cost.
India, from reports I've seen, was reporting that they were pretty much in control of the virus a couple of months ago. Talk to us about how things changed, and where I want to get with regard to this question is what sort of lessons can other countries learn who are seeing a bit of a lull in terms of new infections? What sort of lessons can they learn from India?
I think the biggest lesson is that you cannot let your guard down, especially if your entire country has not been vaccinated, because that's the mistake India made. In September, you saw infections here hitting a peak of just over 96,000 cases, and then there was a stark fall in cases, and that dip continued for at least 4 months, and that led to this false sense of complacency. And in that duration, several new COVID-19 facilities that were set up at the start of the pandemic were shut down. They were not in use anymore. And now what's happening is, as cases mount every single day, as people struggle to get access to hospital beds, oxygen and essential drugs, it's a scramble to set these facilities up again. And every day lost is leading to deaths that would have been avoidable. So the biggest lesson is that this virus is not going anywhere anytime soon, at least not until we can ensure every single person who needs a vaccine gets it.
Yeah, no doubt. Neha, Poonia, we thank you very much indeed for your reporting. No doubt this is a developing story. We'll touch base with you as and when there are more developments. Neha, Poonia, live for us in India. Thank you.